Causes of laminitis include Cushing's disease, which is abnormal regulation of the pituitary gland in the brain, equine metabolic syndrome, which causes dysfunction of insulin regulation due to chronic obesity, cereal or grain overload, access to too much feed, which can cause toxemia in the gut, trauma, so fast work on very hard surfaces for a long time, toxemia caused by serious diseases such as pneumonia, colic surgery, systemic infections, and overloading, where occasionally a severe lameness on the opposite leg will cause overloading and tearing of the laminae on that leg. The current slide shows the lab test is commonly performed for Cushing's disease, where we measure a chemical in the blood called adrenocorticotropic hormone, which is released by the pituitary gland. Elevated levels are indicative of this disease. Laminitis should always be treated as an emergency. Rotation or sinking of the pedal bone can happen within minutes to hours of the onset of the condition. Rapid treatment reduces the severity, the pain for the horse, and the long-term consequences. The definition of laminitis is inflammation of the laminae that attach the pedal bone to the hoof wall. This inflammation allows the pedal bone to detach from the hoof wall. Pull from the deep digital flexor tendon that attaches down the back of the leg into the back of the pedal bone can cause rotation. The weight of the horse may also cause the pedal bone to sink, which is more commonly called founder. These changes can never fully be recovered from and will need lifelong management, with the risk of future bouts of further laminitis. This radiograph of a laminitic horse shows clear rotation with the divergent angle between the hoof wall and the front of the pedal bone. The radiograph also shows excessive amount of heel growth. Emergency treatment for laminitis should include restricting food intake. Hay should be soaked for 16 hours to remove most nutrients but leave it as a source of fibre. Limit movement and house on a deep bed, such as shavings or wood chip. Call your veterinary surgeon at once to be able to support the feet and administer pain relief. In summary, always treat laminitis as an emergency. Immediately restrict movement and feed, providing sole support with pads, painkillers, analgesics, and diagnosing the underlying cause are essential. The effects of laminitis will be lifelong and need to be managed.